Knock, knock. Hello. I'm Shan. I will be your nurse for today. How are you? Can you tell me your name and date of birth? And I will check the name and date of birth. Okay. Alright, Miss Martin. Is it okay if I do a quick assessment on you? I know you just came back from having a total hysterectomy. Is it okay? I would do body mechanics and allow the bed to come up and lift the head of the bed. Do you have any allergies? She doesn't have any allergies that we're aware of. Okay. All right. So, are you in pain? She did say yes. She had pain meds at 6:15 this morning. So I would check her breath sounds. Take a deep breath in. Deep breath in. Deep breath in. Deep breath in. I would listen to her apical pulse for 1 minute. Okay. Alright, Miss Martin, I just need to get some vital signs on you. So I would check her vitals, blood pressure. I will count for 1 minute for her respirations. I will count for 30 seconds for her radial pulse. And I will also check her O2 sets to make sure they're within normal limits and everything. And then that she just had her total hysterectomy, I will check her incision. So is it okay if I check your incision? Okay. Alright. So her incision is a little bit red and everything. So we will do hand hygiene again and all. So I will take a look at the orders. Okay, so she does have a central line. And she does need a bolus. Okay, so I will ask the charge nurse if she can come and verify the patency of the central line to make sure that it's okay to use for medications and everything. Miss Martin, I have an order for you to get an antibiotic, and I also have an order to run your fluids because you have your blood pressure is running a little low. You're 90/70 right now, so we just want to make sure that you don't get any lower, okay? They also request that we put in a Foley. So I will ask the LPN if it's okay if she could insert the Foley catheter for me in a sterile situation. And I will go get the medications for you and everything. So when I leave out the room, I'm going to put the bed back down while I go grab her medications. Alright, Miss Martin, I'm back. I have your meds and hygiene. Alright, so I'm going to get your medication set up, okay? I am going to call the doctor because I see that we do have an order for a cefepime, but it's not it's not right in here, so it says 2 grams. So I'm gonna call the doctor. Right? So ringing, ring, 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 ring. Hi, this is Dr. Lopez. Hi, Dr. Lopez. This is Shan. I was calling about our patient, Miss Louanna Martin. She is in room 486. She just recently had her total hysterectomy yesterday, and I see you put in an order in for her cefepime, but it says 2 grams per 100 mLs. She does have her vital signs are 90 over 70. Her pulse is 128. Her respirations is 18, and she has a fever of 102.4. Her stats are sitting at 99%. Okay, so I called the doctor and let him know that her order for her antibiotic was put in wrong, so we will get that fixed. But while we wait, we will put in her Foley. Okay. She does have an order for morphine, but that was already given. And she said she's having some nausea, so we will give the nausea. So first I'm going to pick up the pump. And we're going to keep this in the bag right now to keep it well. And so this is your normal saline. And again, like I verified with the charge nurse that her central line was okay to use, and she confirmed that it's okay to use her central line for medications and to use for a bolus. So we're going to run this. And again, she doesn't have any allergies, so that's okay. We do kind of want to watch her respirations, being that she did have the morphine earlier. Alright, so we got that. We're gonna put this in here. Put this on. We're gonna clamp this off because we already got it. So in her I will also call Telly to verify, because she has AFib, so I will call Telly and verify what her, what she's running and what she's looking like on the Telly monitor. kinks or anything. We're not clamped. Okay. So being that her order is not correct, I wouldn't give it until he corrects it. So I will hook up her central line, and we're going to clean it for 30 seconds. I also will give her Zofran for the nausea. But right now we really want to get her blood pressure up and everything. So that isn't concern. Okay. So while that's on, just close lever. And I have that running. And then next we will draw up her medication. And she is getting 4 milligrams of Zofran. So we'll also clean the top for 30 seconds. And again, I'm just gonna draw it up, and my charge nurse will actually give the medication to the central line. We will flush. The line before to make sure again that it's patent. We will draw before. And again, we have that ready to go. And I would reassess in 30 minutes to see if the nausea and pain has gone away. So the Foley catheter is in, and we'll just get a urine sample. So in order to do the urine sample, we would kink it off at the port, up here. We would kink it off at the port and wait 30 minutes, and then we will grab the sample from here so we can get a clean cage. Alright. Again, hand hygiene, change my gloves. I will also ask Miss Martin if she's feeling better from. Are you feeling better or are you feeling worse? And then again, we really would just kind of palpate lightly to kind of see for her incision that she had, her total hysterectomy. Again, we will bring the bed back up. Bring the bed back up to our level for body mechanics. And ask her if the pain is getting worse or is it getting better, the intensity of the pain, being that she got morphine at 6:15, to see if it's getting, if it's helping it or if we should get anything else. Also, we would reassess her vital signs after giving her the bolus of fluid. and everything. And and then we would call. I had the nurse to call the LPN. I delegated her to call and check for placement for the central line, and everything is in place and okay. Though again, the charge nurse had already checked prior before. I saw her O2 sets was good, so and everything, and then her Foley catheter is going to be discontinued. She did get the 4 milligrams of Zofran, and she said she's feeling a lot better, so that helped. Then that her history with AFib, and we're skeptical on her getting transferred to PCU because she may be hemorrhaging. So that's a possibility, and we just want to make sure everything is good with that. So we would lower the bed back down. We would check the urine and see what her output is. She's at 400 for her urine output. So her kidneys are working. That's good. They're working like it's supposed to. Alright. And we had the pump to still go in, giving her those fluids. So that's that. And we're only gonna put up one. We're only gonna put up one side rail. You also would wanna check and make sure that her Foley bag is not caught on anything, like the body of the bed that's gonna get hung up. So you only need one rail up to make sure that she's not in a restraint. Check and make sure that her central line is still doing okay. It does look like it needs to be changed, but I'll make sure I run that by the charge nurse so we can get it changed out today and everything. And the doctor changed the order. So again, hand hygiene, because I did touch and everything, and then her central line is very prone to getting infection. So we always want to make sure we change our gorillas doing anything with the central line or close by the central line, or just our patient period. Okay. All right. Focus assessment. All right. So we're gonna hang up her antibiotics before she goes to PCU, and then we will call PCU and let them know that she's coming up. So how you would do this, you would hook up your secondary. This is your secondary. Fluid. And everything. And make sure that you prime your tubing. And also make sure that you clamp so you don't waste any of the antibiotic. So again, it's the secondary. So we're gonna prime this too. just enough because you don't want to get any bubbles. Air bubbles. You want to make sure your air bubbles are out. And then you will take another alcohol prep. And you would clean the top for 30 seconds. And you would hook this up and you would program it until, so you hit B, and then they want it to be 66.794 for an hour and 25. And then we'll hit start. And so now, and make sure that it's dripping. So now you have your antibiotic going, and then you have your so once that finished, then your fluids will start back. Okay, and so again, we gave it. Okay, all right, Miss Martin, is there anything I can do for you? So you're gonna go to PCU. I'm just gonna give them a call to let them know that you're coming up, okay? And everything. But I hope you feel better, and all, okay? So I will call, all right? Calling PCU and giving my SBAR. We have Miss Martin. Date of birth is January 24th. She has no known allergies. She had her surgery of a total hysterectomy yesterday. She has a history of AFib, hypertension, GERD, and endometriosis. She's stable for right now. We just gave her 1 liter of bolus, and we also gave her antibiotics, cefepime, and also she does have a central line. We made sure that it was patent. She had 400 milliliters to come out of her Foley. So her urine output is really good at this time. And she's AFib, so we do have her hooked up to a telemonitor. I know up in PCU they have them hooked up to their own monitor as well. And other than that, she's pretty stable right now. Her blood pressure was low. It was 90/70, so that's why we gave her the bolus. And we're afraid that either she is hemorrhaging or she has sepsis from the infection. Infection from the incision. It was drainage, kind of saturated, so we did a dressing change and everything, and now it's pretty much okay. And again, like I said, she does have a central line, so an X-ray already checked for the placement and all, and made sure that her Foley was intact. We did get a urine sample, so we're waiting for the results from that to come back. And I think that is it. Do you have any questions or anything like that? So then the nurses will either tell me that we're good, or also we gave her Zofran for nausea. She felt nauseous. She did say that her nausea has gone and she's feeling better, so that's good. But I will ask the nurse if they have any other questions, or if they need me to do anything else before I did my handoff with Miss Martin. And I will make sure like all her leads and stuff is on. She had all her belongings and everything before we were to go. and everything. And of course, I would double check for patency for her central line before we send her up, and everything. She was having a little bit of bowel sounds, so that's good. It is still tender to touch her incision area and everything. And we are encouraging ovulation. Miss Martin, eventually we'll have to get up and do some walking when we get your blood pressure back up and everything, because walking is going to help with the pain, and it's gonna get those bowels going, because we don't want you to get an ileus while recovering. So we're going to get up and move around some, just enough to tolerate, nothing too crazy, just to make sure that you're keeping your body moving and everything. Do you have any questions for us? And of course, she would relay any of the questions that she have. And any recommendations or any concerns. Do you have any concerns, Miss Martin? And of course, she would relay those concerns. And again, we did call the doctor and get that antibiotic changed.